Wait a minute. There we go. Recording has started. Hello, stranger. I think I
Hey, ladies,
recognize
how
your
are we?
face.
how, how can I
Hi.
forget you two?
I know we're absolutely fabulous. Yes, we are. Well,
Hell yeah.
one thing, well, I want to tell you is what we do before we begin. We always honor those who come on. We want them to know why they're here. And we want them to be able to have a conversation with us. This is a conversation. We want you to talk about yourself in an amazing way so the world will be able to hear all about what you're doing and even what you think could be in the future for sleep. So we want to let you know that we are so grateful that you are calling from where?
I'm calling from Brisbane, Australia.
Woo! Oh my god, we went international. But anyway, I want to thank you so much. We had such a wonderful conversation with you the last time, and we were supposed to only give you 15 minutes, and we actually talked over an hour. So we figured that, we'll just go ahead and add this little time on. But it was such a wonderful time. I know everyone is going to be so excited to hear about what you're doing, where you are. And I was taken by what you were talking to us about, how what you are presenting there could actually help us here in America with our APPs, our advanced practitioners. And I just can't wait for everybody to hear all about what you're doing. But I'm gonna let Kelly say her part right now. Go ahead, Kelly girl. That's
Yes.
Kelly OG.
Hey, Phil. It's so great to see you again. So Phil and I met on LinkedIn,
Mhm.
and he was interested in what we were doing in the United States, and I was like, "Well, I'm interested to see what you're doing in Australia." So, as Donnie mentioned, we actually all three of us met on a meeting, and 30 minutes ended up being almost an hour and a half. It was a fascinating conversation because I was asking him about obesity. United States is known for obesity, so I asked him what goes on in Australia, and he could answer all that in a moment. But and asked about sleep navigation, and I think it's so cool to talk to someone internationally like this, and for others to hear in the United States about what's going on in Australia. And maybe one day we'll all come together, and this podcast will help reach out to many people where we all have our own conference, and it's just about sleep coaching, sleep education, sleep navigation, clinical sleep health practitioners. We do our own conference. It'll be the most exciting conference ever because it'll be something that we all want to hear throughout the entire day. So with no further ado, thank you for coming on. I want you to tell everyone about yourself, your company. Have
Yeah.
at
Great.
it.
All right, guys. Well, look, I'm one of the OGs. I've been in sleep for like 25 years, mate. When I started, we were using Sullivan machines, not ResMed machines. It's that long ago. So I've been here since the dawn of time. I mean, at least I was using a digital PSGs rather than the old paper ones. But I know plenty of people who used to use the old paper. But look, I'm allied health. I've been working in sleep for a very long time. I was the director here at a large tertiary hospital here in Brisbane, Australia. We've actually got a couple of large tertiary hospitals here in Brisbane. Quite fortunate and lucky enough to have that. Um, and look, guys, about a year ago, I decided to leave my role to try and start allied health led care in the assessment and management of sleep disorders. Now, to be clear for those listening, that the most appropriate disorders for allied health to manage is uncomplicated OSA and insomnia. And that's what I manage exclusively. I work with sleep physicians, I work with nurses. Psychologists and the like. And most importantly, I work with my general practitioners or primary care physicians, or practitioners, I should say. Yeah, and it's been really enlightening. It's been a really thorough, exciting experience to be able to take that clinical ownership and responsibility of people's care. I In terms of the technical stuff, I do type 2 PSGs, and we have a lot of type 2 sleep studies here in Australia. It's actually probably, I'd say, about 90% of our sleep studies are done in the type 2 environment here in Australia. and again, I'm a bit of a perfectionist. I'm a total sleep nerd. So for me, I use a type 2 device that essentially allows me to do type 1s, but in the type 2 environment. So the only thing I miss is digital video and attendance. But I'm so good at putting my leads on. I don't need attendance for diagnostics and the digital video, yeah, sure. I mean, it's great to characterize movement disorders, but if we're getting to that sort of level, we're expanding beyond uncomplicated OSA and insomnia anyway, and then we can sort of refer on to a specialist physician from there. So I get referrals from GPs, and generally I get them for one of two reasons. And generally it's either they were looking to rule in obstructive sleep apnea, those that have like a high pre-test probability of having obstructive sleep apnea, or they've got other kind of comorbidities going on or complex issues, and they want to rule out sleep apnea as a consideration within their pathways. So that's typically where most of my referrals will come from. I also get a lot of referrals in from specialists who want to start people on therapy, and then I'll initiate that as well. So to give you a nutshell, I do it all remotely. So I don't I don't have bricks and mortar. I'm here in one of my bedrooms in my home, is now my home office. And I travel out to my clients. I see them face to face. I put the device on them. I do all the clinical history. We do all the clinical measurements, all that sort of stuff we do there in the home. I then come back the next morning at some sort of stupid, ungodly hour, because I'm a sleep scientist, do as we say, not as we do. And I'll get out there in the morning, I'll take the leads off. I analyze the study while I'm there and then right there and then in their home. And that way, then it allows me to then have a decent consultation with these clients and really kind of allow them to go, hey, remember last night you fell asleep on the couch, or there's this period you're awake, and it really kind of links the sleep study into their own experiential happening during the sleep study. And so when I can then show them and demonstrate what obstructive sleep apnea is, or what periodic limb movement disorder is, or whatever we happen to find, the amount of arousals or sleep fragmentation or whatever it is that's in the sleep study, it's there, they're in their home, they're comfortable. And look, if we need to initiate therapy, I'll just pull it out of my bag and here we are, we'll start it straight away. I look at the main two therapies I initiate, at least initially for trials, would be CPAP therapy, and I use APAP most of the time. And that's a managed trial with weekly consultations done by telehealth and over a month period. Or I use a positional device, and we use a device called a night shift sleep positioner, and it's a little vibrotactile device that sits around the neck, and if they roll into a supine position, the device can vibrate and move them onto their side. We can also use it for observation mode as well. So if people say, I don't sleep on my back, last night was different, I can put it in observation mode and we can test that out as well as part of the trial. So it's been a really rewarding experience to be able to have that all in one. A lot of the time, a lot of the clients, particularly, they hate going into hospitals if they can avoid it. But there's some people just have to go into a hospital setting. There's no ifs, buts, or maybes about that. But for some people, that is enough to stop them wanting to even get screened in the first place. So that's a plus in terms of the way that I'm approaching this. But more importantly, I think it's really great to be able to sort of link in their problem with their disorder, be able to do it in their home, immediately get the results, and they don't have to go from point A to point B and go and get some other test done over here and then go get some therapy from some strip mall joint over here or some retailer or whatever. And I think for me, it allows me to be able to bring that knowledge, that skill sets that we have that in our industry anyway, in Australia, it's almost completely cordoned off in the tertiary hospital setting. That's where most of our experience lies. That's where most of us that have been, doing this for 20 something years live and work. And that's where all the knowledge is. That's where all those registered certifications, or professionals that hold those work. That's where the specialists are. That's where everyone who knows what they're doing tends to live. And one of the reasons why I started doing this allied health-led model is because what I've noticed over the last 20 years, and I'm pretty passionate about this, I think you can probably tell I'm about as passionate as Donnie, I reckon. And what I've noticed, mate, is like 20 years ago, everyone went into hospital, everyone saw a specialist, everyone had the highest possible level of assessment and sleep disorders management and CPAP therapy trials and the like. It was all physician led, or it was all sort of led by registered professionals. And as time's gone on, man, like the numbers are too big. Like the disease burden's huge. Like over the age of 40, over half of our population over the age of 40 has either obstructive sleep apnea or insomnia or some form of combination of both, which is called COMISA. And that's those numbers we just can't meet that need. So there's been this huge burden of disease burden around, and what's ended up rising to meet that need is a retail space. And it's almost in Australia anyway, it's a real production line. And we are just using any kind of sleep test that's in any way validated. We'll just throw them on that, do the study, get us some specialist somewhere to just give it a rubber stamp, and then we just sell them CPAP. And in Australia, it's a little bit different to the US, because here you can just go off and buy a CPAP machine off the shelf without a script. You can just go and buy an automatic CPAP machine here in Australia, no problem at all. So there's this, it's a wild west. It's the excuse the pun, calling it Wild West. I'm talking a couple of Americans here, but it really is. And I've just noticed this decline in quality. And being from the tertiary center, I'm solving those problems. They're coming to me going, I got this machine, I don't know why I need it. And it's just this, it's just not done well. And I know that when it's sleep apnea and insomnia is assessed and managed correctly, the outcomes for people are remarkable. It's life changing. And that's why
Can
I'm
you
still
talk?
doing it 25 years later.
Can you tell us what when you say that, what have you seen that's like remarkable when you said it just really works out?
Oh, for obstructive sleep apnea? Oh, mate,
Mhm.
like, this is like it impacts everything, mood, cognitive function. People get excited because they see their blood pressure coming down and it's getting normal again.
Mhm.
It drops the risk of cardiac death by 2 to 6 times, like, um, people have energy to play with their grandkids. People aren't falling asleep driving while they drive long haul trucks. Like this is the sort of stuff, like it really is powerful. And mate, sometimes it happens overnight with the first night on therapy and they just go, Phil, this is amazing. I feel better. This is incredible. I love it. Don't care. Don't want the rest of the trial. Sign me up right now. And other times, it can take a little while, but most of the time the experiences will vary a little bit. But at the end of the day, most people feel more refreshed. They'll function better, particularly at work. They will stop falling asleep in front of the TV in the evening, stop falling asleep at traffic lights while driving, stop, having brain fog. Their cardiovascular functions will improve dramatically, and just lowers their risk of everything, of a lot of comorbidities that come with cardiovascular comorbidities, as well as metabolic comorbidities as well, blood pressure and the like. So diabetes management can become a lot more better managed through traditional means as well. So by treating obstructive sleep apnea, you can really change people's lives for the better. And to see it happen to your own patient that you manage is just so rewarding.
Phil, can you talk a little bit more about, because sometimes they want to give up, and you said it takes a little longer for some people. Can you talk about that a little bit more? Because people need to understand you may not have it like your sister. Your sister might have had that woo, then that one night
100%.
is all they need, but everyone doesn't get that
Absolutely.
experience.
Yeah, look, mate, that happens a lot. Everyone's experience is different. And particularly you notice it with like high achievers or people who are just used to getting things done. And if I solve a problem, I can do the equation. It's not. And typically there's going to be four key measures that'll determine your likelihood of success with CPAP therapy. And we're talking mostly about CPAP here. One is that you understand that you have a very severe condition or significant condition that needs to be treated. And if so, therefore, you're motivated to do it. Two, supportive bed partner. If you have a bed partner, but generally a supportive bed partner is really helpful because it's a team approach. They want to motivate you and that can really help. Three, you feel better. And if you feel better, mate, people will run through walls to feel good. Like that is a huge motivator. Now, but that can vary for what that means for some people. For some people, it's a lightning bolt. This is incredible. But for others, it can be more subtle. It can be that, I I don't feel like I'm starting to doze off in the afternoons. I actually got out and did mowed the lawn on the weekend without having the wife getting angry at me, or I kind of I feel more motivated. I'm getting things done a little bit more. And sometimes it's you got to wait for a few months, and then they go camping or something, and they can't use the machine, and they go, "Oh my God, I forgot how bad I used to feel," and that happens a lot too. So that's the third one, and then the last one, and I think this is the most important measure of whether someone's going to be successful or not with therapy, and it's about avoiding negative experiences with it. And if you can avoid negative experiences, that is a huge point. Now, most people with a negative experience comes from a sensitivity to wearing the mask and the pressure. Generally, it's the pressure when you first put it on. That pressure, it can feel weird. You open your mouth, air comes out, and it's just all new, different. And the first time you put a CPAP mask on, all you're thinking about is your breathing. Breathing in and out, it feels different. It's unusual. We've been breathing this, I've been breathing like I'm breathing right now for 43 years. And to all of a sudden put CPAP on, it'd be a remarkable change. So what I say very clearly to all of my patients I put on therapy is to take your time. If you're getting into bed and you think this thing, oh my God, I can't do this, this is too much, you went too quick. Go back, find something, anything you can do that's going to distract you, whether it's doom scrolling on your phone, watching a movie. Video games are awesome if you're a video gamer because you'll fully concentrate on that. It could be knitting, it could be doing work at home, work from home. Just be awake, put the machine on and wear it, and just spend as much time as you can wearing it until you're ready to take it into the bedroom and give it a crack sleeping with it. And if you start noticing you're struggling again, maybe you're not quite ready again. Maybe you take it out again, or maybe you're almost there and you're just getting a little bit frustrated because you're not meeting some imaginary measures of success that you thought you would have, or your mate had, or your sister had, or whatever. But yeah, don't set unnecessary expectations. It's a marathon. It's not a sprint. And if it takes you 3 weeks before you can wear it for a couple of nights in a row, that's cool, man. Like everyone's journey's different. We know we need to make this work. So, we just need to take our time to get that to get that to happen.
Exactly. Awesome. Anything, Kelly OJ?
So I
Or
love
she
your
your original goddess. He's an original gangster.
so I love your allied health model because that's not something that occurs that I'm aware of in the United States. Um, when you give them and the fact that you just whip out the CPAP all there at one time is amazing. And the fact that you probably show them what they're doing when they're sleeping, which I think a lot of people appreciate when you're explaining this is your brain, this is when you stop breathing, look what your oxygen is doing, look what your heart. Do you do that, right?
Yeah, 100%. Absolutely. Do a
I
very
think that's
detailed model.
awesome. Now, do you also do you track them remotely to see how they're doing?
100%. Absolutely. And it's a managed trial. I call my clients every week. We have weekly telehealths every single week up until while they're on trial. And then we do managed care from that point on. And that is the key here, because in your retail space, it's here, buy a machine, see you later, give us a ring if something happens. And no one knows if it's working or not. And so that's a big ticket item. Guys, I often tell people this and they don't believe me, but it's true. In about 100 years ago, there was a nurse out in the bush in Australia, and she started using some techniques to sort of help post polio victims, and those techniques formed the foundation of physiotherapy, and that's where it started. And like physios, like occupational therapists, like speech pathologists, like pharmacists, like psychologists, they all act as individual solo practitioners. And that's the height of their profession, is to run their own clinic, run their own service, and they're considered as a well-known and established profession. That's what I want for sleep disorders. And I want that for clinical, well, we call them clinical physiologists in Australia, but sleep scientist is probably the most renowned term. And that's what I want for us. And that's why I left a very well paid job, put 6 figures on my mortgage to kind of create this system to try and make it available for any scientist who has that level of qualification, those top tier qualifications, that if they want to come and do it, that's what Bedpost is about. It's about making a platform to allow you to do that. And as I'm saying, as of now, it's going on to managed care. We can now use a range of technologies to be able to better manage patients' care ongoing. And that's oxygen, SpO2, that's managing sleep, that's managing CPAP data, it's managing a range of questionnaires and clinical information and tracking that, because general practitioners don't have the time or bandwidth or even the knowledge base to do this effectively. So to be able to be that fulcrum, that point of care is super important, and I think it's really needed in our space, because otherwise retail growers are just going to take over. And I think sleep scientists are going to be dead in the water in 10 years time, because we're moving away from that tertiary hospital center. So unless we grab our profession and show how valuable and how useful we can be, we're gone. So and there's specialists aren't going to meet the need. They can't. So they need us. Our communities need us. And I'm telling you, if you've got, I'm only in a small little section of Brisbane, less than 200,000 people in my area that I'm targeting. I've got four large tertiary hospitals in my catchment area, all have 6-bed sleep labs. I've got at least 6 other providers like the strip mall home sleep studies services. And in 1 year, I'm almost full. My clinic's almost full because I've got that relationship with my doctors and my referring base. And I'm telling you, it's lucrative. I'm earning, as next year, in the next coming year, I'm going to earn more than I was as a director prior to starting this. So I would say, and in Australian dollars, I don't know what it is in Yankee Doodles, but in Australia dollars, we you'd be looking at around about 160 to 240K a year running your own business. And that would be, you convert that down to US dollars, and I'm sure it's a lucrative career path, and probably almost one of the most lucrative allied health career paths if you want to go down that path. So I've called this Bedpost Sleep Collective because I want it to be a collective of us professionals all working together. So if I've got a complex case, I can pick up the phone and call Donnie, and Donnie's going to give me some advice. I could shoot over and call, go and call Kelly, because Kelly knows someone. Actually, Kelly's got this great psychologist she might hook me up with, and I might be able to lean on. That's the whole idea, but it's managed care and it's ongoing managed chronic disease management, which means that I'm going to be full. I'll be full in 5 years. I'll be seeing all review patients all day, every day. I'm going to need the next person coming along to start seeing the new patients, because I'm going to get full. Like you'll see your sleep specialists in your hospitals. They're full, man. They keep seeing their patients ongoing, and it'll happen to us too. So there's a huge career. It's not only is it a massive career path, but it's an opportunity for us as a discipline to really wedge ourselves right in there between GPs and specialists and own that space. And you need those relationships as well. And
Mm-hmm.
that's what I get crazy, and that's why I get kept up at night, and that's why I sleep terribly, because I just see this huge vision ahead of me of where we could be, and I feel like I've got to use my MBA for something. I mean, last time I was over in the States was when I was studying with I did a project with Wharton Executive MBA School over there, and then I went back again and did another semester at Harvard. So I love the US. I love you guys over there. So, mate, if there's any opportunity for us to work together in future, please contact me. I'm the only Phil Teuwen in the world, so reach out. I'm not a stranger. My door's open. Let's do it. Let's change the world, guys. Let's do it. That's what I'm about. That's what I'm about. That's why I'm here today.
I love it. Definitely give Donnie all your information that you want posted, because I have a feeling people in the United States and probably other countries are going to get very excited after they hear this podcast, after they hear you speaking, because it's a dream of many people, but in the United States, insurance hinders us in so many ways, even physicians. So where you are, do you guys use insurance, or are you mostly self-pay? How are you all doing this?
Self-pay, and I'm still cheaper than seeing a specialist.
And they're having better
Wow.
care because you're actually holding their hand through their journey to making sure they're successful and they don't drop off. And
100%.
if they don't tolerate CPAP, then do you kick them over to like oral appliance or something like that? You have
Yeah,
relationships with
100%.
those
Yeah,
people?
absolutely. Yep, and I can even I'm trying to push the manufacturers to make better temporary mandibular advancement splints, because the idea being that you can get one made, a temporary one, and then do a sleep study and prove whether it works, and then you can go and spend the oh God, they're expensive to get one made. They cost as much as CPAP over here to get one made. But and you just want to test that it works first, or I could go and get one made, and we can hook them up with dentists. We have a fellowship in dental sleep medicine here in Australia, so I've got a couple of dentists that I did a lot of their training for as a part of that fellowship when I was at the Wes, and yeah, so I use them. They're the guys that I send my patients straight to. Or technically, sorry, I've got to call them clients now. But they're the ones I send my clients to is to go and see those dentists. So yeah, and that's a whole part of being an individual practitioner. You need dentists, you need psychologists, you need sleep specialists, you need GPs, you need the lot because you see everything and you need to make sure that these things get flagged and your clients can be directed appropriately. Absolutely.
I love it. It's a dream. I don't know if it'll ever happen in the United States, but hey, you never know because all these people fall through the cracks all the time. And
Mm,
kudos to you for taking a chance and doing something that you had a vision for. Because there's a lot of people that want to do something, but they're always afraid. Because one, money is a
mm,
big thing, but you took a chance and did it. So, um,
mm.
how many there's a shortage, speaking with us, there's a shortage of RPSGTs, a shortage of CCSHs. What's the number of sleep scientists in your
Mm.
area? Is there a shortage or is there
It
abundance?
Look, it's a great question. In Australia, there's no minimum requirement to be a sleep scientist. There's nothing. There's no legal requirement. Just appropriate training is all there is in terms of like the formal, government type legislation. So we have registered professions. We have a governing body who registers and manages our sleep registrations, and it's called the Australian Council of Clinical Physiologists. And we combined sleep, respiratory, and cardiac and electroneurophysiology as one sort of discipline. And in doing that, it gives us uh, a better position. It gives us more bargaining power and kind of makes us more known. And so that's our registration. That's professional registration. Then, you can do the RPSGT. That's more of an entry level type qualification. But we have a certification exam here in Australia and it's done by our professional body, which is the Australian New Zealand Sleep Science Association, or ANZA. If you've got the problem, we've got the ANZA. And it's got an exam, and it's a really hard exam, and it's designed that way deliberately. I think it's about an 80, you got to get 80 or 85% to pass, and it's got about a 50 or a 60% fail rate. So it's a really tough exam, and it goes across everything. Like it's a really detailed exam. So if you can pass that, that's the highest level. But we have like master's degrees, we have postgrad certs and those sorts of things as well, that you could do to do your training. But most of the time, it's just a degree with a solid basis in human anatomy and physiology, and then a lot of on-the-job training. You generally then become a registered professional, and you would then become a member of our professional body. And if you're, silly enough to want to go and do this tough exam, then by all means come and do that exam as well.
Oh, you're on mute, Donnie.
I know the dog's making some noise. I didn't want you guys to hear the dog.
Uh,
He decided to be a little rough today.
well, we are coming to an end. So I have two things for you, and then Donnie may have something for you as well. One is, where do you see sleep going in the next year to 5 years in Australia? And then what's your big vision, maybe including other countries? And then my other
Well, what
question
I
would be anything that you want to add at the end that you want the audience to know?
Um, Look, we firstly, I guess, where are we going? I think if I put my realist hat on, I think we're going in the direction of wearables, low effort, low friction diagnostics, which would be wearables, that sort of thing. And I think we're heading away from people seeing registered professionals to help manage their care. I think it's going very much leaning into the retail space. I see that's the reality of where we're going to head. Where I'd like to see it change is sort of, again, moving into exactly what I'm trying to do is actually give us a registered career pathway that's attractive. It's something that we would like to go and it's aspirational in nature and it's super rewarding. So that's where I'd love to see us go. Additionally, I'd love to use the technology that we're currently using for diagnostics for treatment management because if if we could better measure sleep, if we could better measure oximetry, if we could better understand the person that we're treating, rather than treating an AHI or an RDI, and for those listening, that they're the number of times you stop breathing per hour. If we could treat the actual person's sleepiness, their data, their outcomes that they're looking for, we could focus on that rather than just focusing on a number, we'd get a lot more traction, and that way we can then start to manage and assess the more important clinical measures within a person's health. That's where I'd like to see us use the technology to move forward. And that's my focus now, is to start to build my platform to have that ability to be able to manage, track, and monitor therapies, whatever that therapy is, and manage it in a lot more effective way. That's where I'd like to see it go. And I guess the only other thing I'd add is really COMISA is something I'd encourage your listeners to look up as well, and insomnia as well. There's a range of online type insomnia management tools now. There's a lot of literature and research going on in the insomnia space, and I think it's a really exciting place to be, because often your poor sleep or sleep disorders isn't always just obstructive sleep apnea. There's generally other things going on as well, and you want to kind of really understand those together. And if we're just constantly, as a profession or as an industry, just so siloed in sleep apnea, CPAP, or mandibular advancement positional device, and then forgetting about everything else that could be impacting on this person's sleep, we're really doing our patients, our clients, a disservice. So that's what I'd really love and encourage us all to start looking into, is insomnia, cognitive behavioral therapy for insomnia, both face-to-face and online, and COMISA, because that's a very common. Obstructive sleep apnea and insomnia go almost hand in hand quite a lot, particularly when you treat the obstructive sleep apnea and you're still not getting the result. I'm still not feeling as good as I wanted to feel. Then often there's something else going on, and it'd be great for us to sort of, as a profession and as an industry, to acknowledge that a bit more and lean into it, rather than sort of seeing it as something psychologists deal with, not us, and that sort of thing. I think it's our problem too.
I love it. I'll just say this last thing. The fact that you said, I almost want you to say it again, because one thing I say to my patients is, if you have sleep apnea and you treat it and you feel great, but you're still not feeling as good as you thought you should, you need to go back, because so many of my patients do not go back, and they think, well, I guess this is just how it is. And it's not. And it's not either told to them in that way, or they're not understanding because they don't have someone like you or Donnie or I telling them that. So say that again. If they're on treatment and they're still not feeling well, maybe it's something else going on, right? Because there's like 82 sleep disorders.
100%. And there's some pretty wild sleep disorders too. I lecture in pathophysiology of sleep disorders, and exploding head syndrome's a funny one, and hypnic jerks and all these sorts of stuff. So there's a lot of wild stuff going on there. But also, and I think to take your point, Kelly, this is what we call managed care. And that's the difference. It's not just, here's your CPAP or your positional device, your mandibular advancement, see you later. It's, here's this. I'll see you again in 12 months, and I'm going to reassess you in 12 months. And that way, then, if we do pick up that you're not feeling as well as that you should, then we can start trying to understand why. What time are you going to bed? What time are you waking up? What sort of external stresses do you have? What are your lifestyle factors? Do you have any other health considerations? Has your medication changed? It's so multifactorial. Sleep and sleep studies are one of the most comprehensive tests available in medicine. We measure the brain, the lungs, the heart, the legs, the muscle, all of this stuff, and we do it all together for an 8-hour plus period. So, we're a holistic assessment or industry, because sleep isn't just a heart or a lung or a brain. It's everything and all in together.
Wait a minute, say that again. It's what? Sleep is what? Say that again.
Sleep is everything all together.
Oh, you figure, right? Nobody's thinking about that, right? It's not the foundation. Oh, well, goodness.
Yes,
That's
100%.
awesome. Oh, thank you so much. Thank you. Thank you. My dog stopped making all that noise. So thank you so much for honoring us again with your presence. And we love your passion. It is contagious. And before you get off, we want you to say a little bit about what you're doing, but with Bedpost. And if you want someone to reach out to you, how can they reach out to you? Because it's very important. Like you said, I
Yeah.
love the way you put us right there in the middle, because that's where I see us, because we're everything
Mm.
truly. We connect, we're like the glue that connects everything, and everybody's trying to do this, and that, and nobody's coming to the center and say, let's meet. And that's where we are.
Mm.
So
And
tell everybody.
to be clear, I really love what you guys are doing, because you're focused in that tertiary hospital space. You've got people that are in for cardiac issues, heart attacks, post-surgery complications, all of that sort of stuff, and that is super needed. And kudos to you for trying to raise the bar of what it means in your space to try and push it up so that people get looked after better. Like, that's awesome. And that's exactly what I'm trying to do here as well. Honestly, my Bedpost Sleep Collective, I'm pretty easy to find. I'm the only Phil Teuwen in the world, so if you jump on LinkedIn, you'll meet up with me. You can reach out to my website at bedpostsc.com.au. Yeah, it's all there. I'm a startup, guys. I'm only 12 months in. I had my anniversary 2 weeks ago. It was 12 months, and when I started,
Congratulations.
I
Congratulations.
had no logo, no website, no nothing, no referrers, no nothing. I started with a clean slate 12 months ago, and I can tell you, it's the best thing I've ever done. I needed this change. I was this close to leaving sleep in general, and I'm so glad that I got the message loud and clear, and I jumped on, and I've leaned into it. And the more I do, the more I start learning and growing as a professional, and bringing up these massive skill sets I didn't know I had. It's just been so rewarding. I love it. So if there's anyone that ever could even think about doing something as crazy as what I've done, man, reach out. Even if you just want to talk shop. I mean, it's pretty clear. I'm pretty excited about this sort of stuff. So reach out, man. Like, I'm an open book. Let's do it.
I think that's a good place to end.
Yes. Thank you
Thank
for
you.
coming on. This was a great conversation.
It definitely was.
Bless you both. Thank you.
Let me stop. Don't go anywhere. Let me stop the recording. Wait just a moment.